Good afternoon and welcome to the inaugural Hearst Community Initiative Town Hall Speaker Series. My name is Evan Zislis. I'm the Director of Community Engagement for the Aspen Institute's Hearst Community Initiative. The work of HCI is focused on promoting dialogue, increasing understanding, and facilitating opportunities for meaningful collaboration among the communities of Aspen to Parachute, Colorado, located on ancestral lands of the Ute tribe. Today kicks off the first of an 8-part speaker series in a collaboration with the regional public libraries and chambers of commerce of Aspen, Basalt, Carbondale, Glenwood Springs, Newcastle, Silt, Rifle, and Parachute. Every 2 weeks from now until the end of July, you can tune in to learn more about the issues facing our communities and the local experts working to find collaborative solutions to the shared challenges of our region. Today's topic is mental wellness in a post-COVID world, co-hosted by the Basalt Regional Library and the Basalt Chamber of Commerce. Today's Zoom host is Garfield County Libraries, and interpretation to Spanish is brought to you by Velasco Language Services. Alex, would you share with everyone how to toggle on the language of their choice?
Of course. And thank you everybody for joining us again. If you allow me a couple of minutes, I will give you the instructions for our interpretation. This is a Zoom webinar. We will have an open chat. If you have any questions or any technical issues, please let me know. We'll also be making use of our Q&A function. If you have a question for our panelists, just type it into the Q&A and we will get to that question at the appropriate time to answer it. The last option here at the end is our interpretation. It is off right now, but as soon as our introduction is done, I will turn that on. And you're going to see a gridded globe in your bottom right-hand options in your Zoom screen. After that point, you need to click on your appropriate channel, whether it's English or Spanish. And if you'd like to mute the original audio so that you do not hear the interpretation going on simultaneously, go ahead and press that. But it's pretty simple to use. You'll click on English or Spanish for your channel. And with that, I'll give it back to Evan.
Thanks so much, Alex. For today's webinar, please use the chat feature for technical questions. You may ask questions for our panel using the Q&A button at the bottom of your screen. We'll leave time at the end to answer as many questions as possible. We've got a lot of ground to cover, so I want to introduce our moderator for today's discussion, Nan Sundin,
de nuestra plática el día de hoy.
In County, where she has pursued equitable healthcare access for nearly 30 years. In 2017, Nan received a Lifetime Achievement Award from the Colorado Association of Nonprofits for her work in regional health equity. In 2018, the Colorado Human Services Directors Association honored her with the Human Services Director of the Year Award. During her tenure, she has led large-scale regional collaborations to achieve equitable access to healthcare, including the successful advancement of projects leading to the West Mountain Regional Health Alliance, the Pitkin County Mental Health Collaborative, Healthy Mountain Communities, and the expansion of Mountain Family Health Centers in Basalt. Joining Nan today are esteemed panelists, Angelina Taylor and Sarah Jacobs. Angelina is the Executive Director of Aspen Strong. Angelina brings passion for mental health to the director position based on lived experience and is devoted to being part of the movement to change the conversation around mental health and well-being. Angelina brings 17 years of business strategy, leadership, and development experience to her position at Aspen Strong. Sarah Jacobs is the behavioral health provider at Mountain Family Health Center's Basalt Clinic. A licensed clinical social worker, Sarah holds a Master of Social Work from the University of Maryland and has worked in the Roaring Fork Valley in the fields of mental and integrated health for the past 10 years. Sarah now provides clinical care for children, adolescents, and adults experiencing mental health issues, including depression, anxiety, trauma, stress, family conflict, and addiction. Our panelists are joined by mental health experts, Sarah Fetishin, Michelle Methuen, and Megan Valise. Sarah Fetishin,
Sarah Fetishin también es terapeuta psicóloga y estudió en Adams State University.
Director of a school-based family resource center, served on child protection teams in Eagle and Pitkin counties, and worked in residential and day treatment programs serving youth with co-occurring disorders. Michelle Muthing, Executive Director for the Aspen Hope Center, is one of the first 5 staff members who helped create the Hope Center in 2010. Michelle is dedicated to connecting community and reducing the stigma associated with mental illness and suicide. Michelle received her graduate degree in clinical psychology with a subspecialty in neuropsychology from Western Carolina University. She has worked as a crisis clinician, conducted psychological evaluations for prison inmates, and functioned as a juvenile coordinator and then executive director of the Rape Crisis Center in Beaufort, South Carolina. Michelle taught for 9 years at the Indiana University Department of Psychology and locally at Colorado Mountain College. Lastly, Megan Valise is a FEMA team lead for the Colorado Spirit Initiative, a disaster response and pandemic recovery program grant funded by FEMA in a collaboration with Mind Springs Health and the Colorado Department of Public Health and Environment, covering 10 counties in western and northwestern Colorado. Megan and her team provide free counseling, psychological first aid, resources linkage, and psychoeducation to anyone in the 10 counties. We're honored to have such a well-rounded group of mental health professionals joining us today. Nan, with that, I'll turn it over to you.
Thanks, Evan. That was really nice. What amazing expertise we have at the table today. And I know that everyone joins me in thanking Basalt Library and Basalt Chamber for the topic of mental wellness in a post-COVID world. It's one of our favorite topics, so we're all happy to be here. I'd like to start by asking Michelle to talk about the neurological impacts of prolonged stress and what are we talking about here with mental wellness?
Thanks, Nan. This is something that has come up pretty frequently over the last 9 months, is how are people coping psychologically with a pandemic that we've never faced as a society or as a world in many, many decades. Neurologically, what you seem to find is people are in this heightened state of awareness. It's not quite fight or flight, and everyone's heard about fight or flight. Fight or flight is a neurological, it's a survival mechanism. Something threatens our well-being and it throws us into this state. But when it is threatening our survival in a quick way, we also get to shut it off and we come back to being able to function. But when it's just enough to really throw people into a state of stress, your parasympathetic nervous system can't really shut it off. And so what we're finding is you see people who are hypervigilant everywhere they go. They're not sure if they're going to walk into a store and there's a new sign on the wall with a new process on how to function or where to walk. You will find that people typically, for survival and stress reduction, your brain shuts to autopilot. Every single one of us have driven down the road and gone, did I pass Crown Mountain? Did I pass the Walmart? You're just on autopilot, and your brain does that to recoup. It does it to check out, really. You know what you're doing, you can function on autopilot. And now we're in a state where our brain can't really shut off like that. You know, you shut onto autopilot to walk into the grocery store, and next thing you know, you have someone correcting you because you're walking down an aisle where there's an arrow, and that arrow wasn't there 2 days ago. So because our brains can't really just go to that place of autopilot and calm us back down, people aren't able to de-stress on a regular basis like we have been so accustomed to. And it's causing heightened stress in many, many ways.
Thank you, Michelle. I'm
Yeah.
thinking, Angelina, you have information on national statistics of basically mental health, mental well-being. Can you share some of what we know nationally, and then we'll talk with the experts about what we're seeing locally with different populations?
Yeah, so kind of adding on to what Michelle was saying, we're seeing a huge uptick in anxiety and depression on a national level. In January to June of 2019, we were seeing 1 in 10 people expressing signs of anxiety and depression, and that's up to 4 in 10. So that's a 30% increase. That's pretty large. We're seeing a 36% increase in people
Un
struggling
aumento de
with
36% de personas que tienen
percent of people struggling with eating disorders, 12% of people increase in alcohol consumption, and 12% seeing worsening chronic conditions. And that's for adults age 25 and older. So the statistics are even more staggering kind of for youth. The 18 to 24-year-olds are really struggling with suicidal thoughts. 26% of youth that were polled by the KFF health tracking poll were reporting signs of suicidal thoughts. 56% reported anxiety and depression, and 25% versus the 12% for adults were using substances.
Thank you. So nationally, we're beginning to see evidence of this impact that Michelle was talking about on the brain and our emotional health. And I'm wondering locally, Sarah Jacobs, you practice in a healthcare setting. Can you describe what you're seeing with special populations? And then we'll talk to Sarah Fetish and Megan.
Yeah, thanks, Nan. I mean, at Mountain Family Health in general, you know, the number of people that are coming in and wanting to meet with people like me, behavioral health providers, has gone up quite a bit. It's kind of doubled. I think we had maybe 500 people a month, and that's across all of the Mountain Family Health clinics before the pandemic seeking behavioral health. And the past month, I think in March, was like 1,000 people over that month seeking that behavioral health care. Definitely also seeing an uptick in folks, maybe like a 5% increase of folks who are coming in looking for treatment for substance abuse issues. That's been, I think, a pressure point just because of isolation people are going through, maybe a little bit lack of access to the in-person supports that they had. And I can go into more later. I do also see with populations who maybe use a caregiver, either because of illness or they have a disability, especially in the beginning of the pandemic. That was a little bit difficult because it was hard to have access to caregivers initially on a consistent basis because of the need to quarantine and things like that.
Thank you. Sarah Fedishin, you are in the schools and have a sense of how is this long-term pandemic impacting our children?
Yes, thanks, Nan. First, I'd like to start with the Basalt community specifically because we are so lucky to have a school-based clinician in Basalt Elementary through funding through the town of Basalt, and then a clinician at the middle and high school from Eagle County funding. This is the first time we've been able to put a clinician from preschool all the way up to high school. So we're super grateful for that support. The timing couldn't be better, obviously. What we're seeing, it kind of mirrors what Angelina was talking about, is our kiddos do have increased anxiety and depression. Specifically, they're worried about the COVID. Is it gonna end? Will it ever end? They have a feeling of loss over some milestone events that they had been looking forward to. So particularly high schoolers, you know, are we going to have prom? Am I going to be able to play my sport that I've been playing for years? They're worried about falling behind academically, you know, trying to get into a good college, you know, their future, and just worried about if they'll be able to meet that criteria when the time comes. They're also feeling really stressed about their parents. Their parents are having to juggle multiple hats, have to stay home to be with them. So just feeling the impact on their families. And we know with some of the economic downturn due to COVID that some families are really struggling that way. And overall, just a sense of kiddos struggling to regulate their emotions. So trying to figure out how to bring that skill building in on what skills they can use today, how they can stay present and not get too far ahead of themselves. I would also say the biggest concern that's come up is the effect of isolation. And so the message we're putting out there is to connect. Even if that's 5 minutes of uninterrupted time with your family, anytime you can get together and connect, it's so important, because the isolation is what we're most worried about and what the long-term effects might be. So I think that's what I have for now, Nan.
Thanks, Sarah. Great, a really good list of what the stressors are for kids and how to mitigate them. Megan, you are working with Colorado Spirit. Can you describe that program and also share with us what you're seeing from the standpoint of the services you're providing?
Absolutely. The Colorado Spirit Initiative is a grant-funded program, a partnership between the Federal Emergency Management Association, or FEMA, and Mine Springs Health locally. And we provide disaster response services. So similar to after a natural disaster, like a hurricane or a tornado, a group of people comes in to provide psychological first aid and psychoeducation to groups, just to see how they're responding and to help them recover from a disaster a little bit more efficiently. This is very different from a natural disaster in the sense that there's no clear beginning and there's really not a clear end. But the services are the same, where we're trying to help people recover emotionally from all of the stress that they've endured in the last year. And what we're seeing at a community level is similar to what everyone else is saying. We're seeing lots of compassion fatigue, which is a unique form of burnout for people in caring professions. So we provide psychoeducation to teachers and child advocates and childcare providers. Anyone who's really in this caring profession, where they're just struggling to continue to find the drive to care for people. And that's because they're dealing, all of us are disaster survivors ourselves, and all of these caring professionals are as well. So trying to summon the energy, to summon the care while you're dealing with so much of that other ongoing stress from the pandemic is significant. We're also seeing lots of this, people not quite sure how to process some of the emotions that they have and how to label those. We're getting feedback from many adult survivors in our counties that they are sick of hearing about self-care. And that's very real, but I think it's not so much that they are sick of hearing about self-care, but they can't tap into self-care because they haven't done the emotional work of processing their grief, their losses, and thinking about grief in much broader terms, not just being the loss of a loved one or the death, but all of those losses that Sarah was just talking about, from children's perspectives, those lost milestones, lost vacation time. Yeah, I think that is where we are in terms of our recovery, is people needing to process all of that, all of the trauma, the collective trauma that we've experienced over the last year.
Thanks, Megan. Anything, Michelle or Angelina, you want to add to that before we look at what would the next question would be? What are
la siguiente pregunta sería, ¿cuáles serían los
someone struggling, or if you're struggling? But before that, Angelina and Michelle, any other thoughts about what you're seeing, or the particular stressors that the pandemic is bringing?
Yeah, for sure. Again, as a crisis center, the Hope Center obviously fields a lot of people who pick up the phone and feel like they're in a major crisis. And we're noticing that the call volume has gone up, and it's not people necessarily feeling suicidal, but some people can't even muddle through the beginning of a conversation to express what they need and what they're going through. They just know that they're off and they can't get back on track. And so, somewhat to what was just referenced with trying to kind of take care of ourselves, take care of other people. It's the smallest little things sometimes that we need, because we're not looking at a major event. People aren't looking at a death. They don't have a sudden trauma in their face where they have to now plan and then process through it and then start the healing. It is an ongoing thing that people continuously ask, where's the light at the end of the tunnel? And so I think we just have to realize we're pretty resilient, and that's hard to muster up some days to say, because you just want it to be gone. And everyone's dealing differently.
Thank you. It reminds me that I just read the New York Times article on, languishing, the word languishing. So what it talked about was that we're not deeply depressed, but we're also not thriving. We're in the middle somewhere. And that's what you're describing, Michelle.
100%.
Yeah. And so it's not a happy place. It's also not a terribly sad place. Though it could be for people, right, who have had major losses during this.
And that goes back to what I said in the beginning with the fight or flight. When you have a major thing, you know how to address it, and you know how to combat it, and you know how to heal yourself and get back to normal. This isn't enough to be, like you just said, major. It's that middle where everyone just feels like they're in mud.
Yeah, just like a chronic condition of being in mud. So Angelina, what should we look for in our friends and our family and our children to see if they're at this place of languishing or struggling?
Yeah, so a lot of things to look for are when people are socially withdrawn. So you're noticing changes in their mood and their behavior. If you're working with them, changing their work output. If they're struggling to just make a decision. I think when we were all talking about this yesterday, Michelle brought up the point that, like, kind of just to assume that everybody's going through something right now. And I think that's if we can kind of come at people with that kind of a bit of understanding for what is that they're probably just experiencing something right now. And like Michelle said, like, they don't really might not even know what it is, but having lived in this mud, as we're calling it, for so long, it might just be hard for them to make a decision. They might just be tired and anxious. If you notice they're changing their eating habits, those kinds of things. And really, like, if people are starting to struggle to see the point in anything, then we really want to address things with them. And really just, I know that it's really hard to start a conversation with somebody about their mental health, but what's worse is to not have the conversation. So just kind of anything that you can do to kind of get in with the person and just kind of check in with them. Even like giving them something to look forward to, inviting them to do something, just kind of that general check-in, just really generally just starting a conversation really kind of can help pull people out of that and start to see, start to maybe see things differently.
Thanks. And I know Michelle talked about, Sarah talked about that connection, right? It's about a connection at this point. Sarah Jacobs, you have some thoughts about survivor guilt and how that may be playing out in the pandemic.
Yeah, I guess I was just thinking along the same lines of what we've been talking about, how this pandemic is a little different in that it's affecting people in different ways. Some people may have lost a loved one, may have been really ill, others haven't. And so, like what Megan was saying, we it might be confusing to think, well, why am I feeling this, these emotions when nothing bad happened to me? But we do have this joint emotional experience, right, where we see others are under suffering, and it might even become kind of like that survival guilt of like, man, where I am living, I'm able to get out, I'm able to be outside and have some socialization, and I might feel that guilt but I know people in other places aren't. So that was just kind of on my mind, is, partly helping folks understand that has been helpful, and kind of knowing that when you're opening the conversation with peers, I think sometimes we can hold back because we're like, yeah, I don't know what they've been through, but it's okay just to realize that you don't know until you ask.
So let's talk about the ask, right? Because it's hard sometimes. There are some barriers to asking, or some fears. What do you all recommend in terms of how you would approach a friend, a colleague, or a neighbor, if you're concerned or you just want to check in? How would you do that?
Well, I'll go. When we do we have a suicide awareness class that we do called We Can Talk, and it's based off of the QPR model: question, persuade, and refer. And the premise is to be bold enough to ask people questions. One of the things we teach clinicians, though, is not to self-disclose. And I think right now that's really hard, because we all want to feel like we have a connection to someone. And I think your human instinct to show that you understand and to show that you have a question or that you have a connection is to tell someone something similar about yourself. So, Nan, if you were to start saying something about life being stressful, it would be natural for someone to say back, yeah, I've had that too. I've gone through this and I've gone through that. And what that does is it brings the conversation to me and off of you. And so we just encourage people to ask questions, ask people, how are you? And let them just talk, not necessarily try to cheer them up, not try to solve their problem, but give them space just to speak. We have people who will come into the office with a loved one for therapy. And when that loved one is back in the office, the person sitting at the front says, is there a crisis counselor I might be able to talk to? People, I think right now are just, they're struggling to just be able to offload without feeling like they're burdening someone else. So just giving friends, family, coworkers space to talk about what they've been through, or just to talk in general, might go a long way in helping someone in their day.
Thanks, Michelle. Sarah Fetishin, is there a different way you might approach children? Is it the same?
I think there's some similarities, but also, with our kiddos, I think we get into a routine, how was school? How'd you do on your math test? Things like that. And I think that we need to put down our electronics, put down whatever may be distracting us, and just talking about how are you feeling? The way I like to check in with my own daughter is what was one thing you were grateful for today? And then was there one thing that made you sad or upset? Because then it gets people talking about feelings and maybe some situations that have come up, and you're going to get very different information with the questions that you ask. So I think even Google it, asking different creative questions to try to get your kids to open up.
Yeah, I remember reading when my child was little, asking questions in a car where you're facing in the same direction and it's not as intimidating, or the power structure is a little different. How about Megan, for you, you're running groups. How do you approach the ask, and what do you think is helpful?
Yeah, it is always a tricky way to start. I mean, if we have individual calls, people who just call into our hotline, the first question is, why are you calling today? Because usually the first thing out of people's mouths before you even say that is, I don't even know where to start. So asking why you're calling gets them kind of at the root of the issue. And we're seeing lots of that unloading that Michelle was talking about, where people just want to dump. some of their experiences on someone else. So typically in our one-on-one calls, we don't have too many repeat callers. Usually we have people call once, we'll talk for about an hour, and then we'll do some check-ins with them periodically, but usually they don't call back. And I think it's just because people are carrying this really heavy load, but as soon as they release it, there is a catharsis in that. They feel immediately better. And I've seen that we're going in the direction of this like one session therapy, how to really get to people in one session. In a group setting, it's a little bit trickier just because people, especially if we're doing a group presentation with a bunch of coworkers, a group of lawyers or a couple of restaurant workers, long haulers, people who maybe don't necessarily know each other, they're less likely to open up. But starting with a shared experience is useful, where you're making that connection. What's something that has been difficult for you lately? I think we're finding that so many people are fulfilling these roles that are not necessarily expected of them, from all levels, whether it's parents who are now teachers, grocery store workers who are now mask enforcers, bartenders and baristas who are de facto therapists. Everyone is filling these roles that they didn't necessarily plan for and are not necessarily skilled for. That generates anxiety within them. So just starting with what's really hard for you right now? What do you wish you could let go of? What do you want to be all done with? Usually can get to the root of the issue.
Thank you. Really great advice from everyone. I'm wondering, before we talk about resources, I'm wondering if, Angelina, do you have a sense, are there any silver linings that you're seeing in the practice or in the business of mental wellness because of the pandemic?
The one thing I've been saying is because of this collective experience that we've been having, it seems to be that people are much more willing to talk about mental health than they were before. And I think that is, hopefully we see the long tail of that after the pandemic. I think there's so much more focus on it. People are wanting to support their workers. People are wanting to support each other. So I hope that that's something that definitely lives on from this. People are really excited about telehealth. There's people that were not able to make it at certain times, or somebody that they wanted to see, they couldn't find somebody that they wanted to see. So they're able to find somebody in a different area that they can see via telehealth, which is really opening up like opportunities for ways to get therapy. And a really exciting article I just read recently was about Colorado is, there's new legislation being put in place for teens to get up to 3 free therapy sessions in the state of Colorado. I think it's going to go, it'll go through maybe the middle of next year or something like that. I think it's a year long term. So I just saw that was some new legislation. I don't know if anybody knows any more about that, but I think that's really exciting. So, and stuff like this, collaborations we've been doing, we have the mental health coordination team, which is a lot of the organizations that are on this call, getting together bi-weekly and just talking about mental health efforts that we can support each other within the region. So I think there are a lot of exciting silver linings in the mental health spectrum. And I think in general, like so many of us have gotten to spend more time with our families. One of my favorite things is the online grocery orders that I can do now from the comfort of my own home. So just, I think as you're kind of evaluating where you're at, taking the time to kind of see some of what those silver linings are a helpful tool to not be so doom and gloom about everything.
Yeah, thank you. A good list of, it isn't all doom and gloom. Does anyone else want to add to that? Any silver linings that you've seen in the practice because of COVID? Or
I can share one from the school.
Oh, go ahead, Sarah.
Oh, sorry, Michelle. You know, I think with the use of being able to meet virtually, we're starting to work together more in the mental health profession and in the schools. And for instance, we do some parent and community education, and so do our partners in Pickens County and in Parachute and in Rifle. And so trying to get everyone together with their resources to bring speakers, to bring support, and to make it more equitable through the whole valley, so that all parents, all community members have access to good information for their families. So that's just exciting to me that we now don't feel like we have to drive and use all these other resources and time and things to get together. We can pop on virtually and start planning and figuring out how to do things, I think, better. So that's exciting from my perspective.
Thanks, Sarah. Michelle, did you want to add something?
I was just going to say it's funny because, again, in the world of crisis, for every 5 people who say they're so glad they can connect via Zoom, you've got 5 people who say, I'm so sick of Zoom. And I think in what we're finding with this pandemic is people who are not naturally high self-monitors, or who don't naturally spend time doing a lot of internal reflection about who they are, where they fit in life, what their goals and passion and future look like. I think people have been forced to do that kind of by default. And I think the biggest silver lining from my perspective that we see here is, regardless of your opinion, Zoom, no Zoom, drive, not drive, telehealth with school, in person, I think people are realizing that they can get through a lot. They can make it through things that they might not have otherwise thought they could make it through, but they've also learned a lot about themselves. I hear that a lot in my personal conversations. I hear it with colleagues and staff and hear it with clients. People have learned a lot about themselves. And I think that's a beautiful thing, particularly for people who don't do that on a regular basis, is have that internal reflection, good, bad, or indifferent. People know themselves a lot better today than they did a year ago.
Thank you. Sarah, go ahead.
Oh yeah, thanks for that, Michelle. I was just thinking, I've even heard people say that in this reevaluation of what's important, they've gotten in contact with family members that maybe they hadn't talked to in a long time. So yeah, there's this desire to maybe not go back to the way it was. Maybe it's a something new that's more enriching for them.
Right. So go ahead, Megan.
I'm also thinking just of vaccination rollout and how successful that has been across so many of our rural counties, and what a silver lining that is. I think it's given lots of people hope. At least in Eagle County last week, we were at 53% of the population had received at least 1 vaccine dose, which is significant. And I think it's certainly a nod to our public health departments and what a great job they're doing. But then also just the transition from winter into summer, I think, has created a shift in people, letting go of some of that seasonal depression that we see, and having a little bit more hope with longer days and warmer days, although, still the intermittent snowstorm here and there between now and June. But I think that creates a renewed sense of hope for people as we move, hopefully, out of this thing.
Thank you. And what I'm hearing from all of you is that a key is in making a connection with people, and not everybody needs therapy or counseling or resources, but there are resources available. And so, Angelina, do you want to share the resource map that was created and explain it?
Can you guys see it?
Yes.
Okay. Yeah, so this is a map to mental health that was created as part of that mental health coordination team effort. And really, it's just an amazing resource guide for whatever kind of services that you're looking for. So there's child and family, different financial supports that you can access, grief and loss specific with Pathfinders, the Spanish services, this map's also in Spanish, crisis lines that you can call, and then where to access counseling and therapy, therapy and case managers. So this map is living on the Aspen Strong site. I'll put the link in the chat so you guys have access to that, and it's in both Spanish and English.
Thanks, Angelina. That is a great piece of work and a nice visual resource of support services that are available. If I could just wrap it up before questions and answers, I'd just like to go.
Con la sección de preguntas y respuestas, si pudiera.
If you had an opportunity to make a call to action for the participants, what would you ask them to do to address mental well-being in the post-COVID world? And we'll just, Michelle, you want to start?
I think it's probably more of a huge broad brush, and probably less true call to action. But I think the most important thing that I think is important for everyone to take away or to think about on a daily basis is we're all different. We all have different opinions. We all have different things that get us through. Those of you who know me know I can have some pretty strong opinions about things. The last year of my life, I have been the most unopinionated person ever. And I think the purpose of that is I realize that people are doing the best they can to get through. And so the takeaway and call to action I think I would have is just to ask everybody, people are doing the best they can. If they're excited about vaccines, that's what's getting them through. If they don't want a vaccine, that's what's getting them through. No matter what, if people want to travel, that's what's getting them through. If you are vehemently opposed to travel, that's what's getting you through. And I think just to be tolerant and understanding of everybody's choices right now is huge, because people are doing what they need to do to survive mentally, psychologically, emotionally. And that's, I think, the one biggest thing I try to tell everybody, my family, my coworkers, my staff, is just know that whatever people are doing, it's what they're doing to get them through. And we all have to kind of understand that in ourselves and in other people.
Thanks, Michelle. Angelina, how about you? Anything you want to add to that?
I would say probably just reach out to somebody that you think might be struggling, if you've been struggling, to have that conversation with them. And again, like we were saying earlier, like it doesn't have to be, it just is like just kind of asking some of those open-ended questions and getting them to talk and kind of get out of their thought loop that's going on inside of their head. So really just reach out and see how somebody's doing.
Thank you. Sarah Jacobs, anything else?
Yeah, I think just along the same lines, you know, have kind of manage expectations of yourself and others, you know, that hopefully things are getting so we can reconnect more, but that people might feel nervous and anxious about that. And that's normal. So just that's something we try to do in Mountain Families, like normalize. We're primary care practice, so people come for all sorts of reasons, and we try and make it just a natural thing that, yeah, you can also talk about mental health here. You can also talk about depression, anxiety, and things like that. So that's my 2 cents.
Thank you. Sarah Fetishin.
Thanks, Nan. Of course, I'm going to say connect. And so, you know, when you're home with the family, if there hasn't been, you haven't connected with a grandparent or, you know, just people in your life, a phone call even can just do a world of good for your family and for that person that you're reaching out to. I also want to say that that community partners work together. So if you do need support and you're not sure who to call, just call someone and we'll help route you to the appropriate agency. We all work really well together, and I don't want people to worry about getting the right number or the right agency will get you to where you need to go. And I guess the last piece is kindness. I was in my doctor's office, and the woman that was helping me, the receptionist, was just crying. And I said, what's going on? And she said, people have been so mean today. And so her boss came in and removed her. And I just thought about, wow, if we all could just breathe and just make sure that we're doing the next kind thing, I think it would go a long ways for a lot of people.
Thank you, Sarah. Great advice. And Megan, last.
Yeah, I mean, very similar to what everyone else has said already, which is just to give grace to others, and give grace to yourselves. We all have so many balls that we're juggling at all times. What's one of the balls that you can let drop for today? What's one of those things that's going to relieve some of the pressure from you, or one of those balls that you can let somebody else drop? Yeah, being kind to yourself and others it's the way out of this.
Excellent advice from everybody. I'm going to turn it over to Evan, who has some questions from the participants. And thank you, everybody.
I'm so grateful for all of you. Please stay on, because you're all invited to chime in with some of these questions. The first one is, what sort of measures have been taken regionally to make sure that we're providing equitable access to all members of our community, regardless of immigration status or what preferred
o diferentes
sorts of access is being provided and offered throughout the region?
I can take this one from, at least from the Colorado Spirit perspective. This is definitely something that has been super important for us from the whole time, and it's challenging when our funding source is FEMA. Certainly, that is not always looked on, happily from people from certain populations. But I think the most important thing that we provided from the very beginning were totally free, anonymous and confidential services. We don't collect any information from people who call in to our hotline. We don't ask for any insurance information or ID of any form. So I think in that way, it creates just a sense of access. And then we also have a wonderful bilingual crisis counselor, Danielle Aguilar, who is doing incredible work in trying to break down some of the barriers in the Latinx communities across our rural counties, some of the stigma that exists in those communities against mental health resource access. So that's, I think, the big one from our perspective.
I think I would just add that all three counties, Pitkin, Eagle, and Garfield, are doing strategic planning around mental health and suicide, Garfield County. And I believe that all three counties are now beginning to lay the lens of equity, diversity, and inclusion on it. It has always been a part of our focus, I would say, in the last 20 years, access. We've not always been successful having different language and different cultural supports. But I do see that we're moving forward in that area.
Anyone else have anything to add on that before I go to the next question?
We do the same, just locally. Colorado Spirits through FEMA, it's statewide. The Hope Center does not ask insurance status, does not run paperwork, does not charge for sessions or have payment associated with crisis sessions. We go to the schools, so we see a lot of the kids at the schools. We have interpreters to be able to help us with anyone from the Latino population, trying to get them connected to resources. But just as a local resource here, we kind of have the same thing, very little paperwork, very little questions asked.
So this presentation was co-hosted by both Basalt Regional Library, but also the Basalt Chamber. And for people that are members of chambers of commerce throughout the region, I wonder if you could speak to those HR departments or people that are running those organizations whether they're small businesses or entrepreneurs themselves. What sorts of things do you recommend for small businesses or organizations that are members of those chambers, either to be aware of or to recommend that are included for employees of those organizations?
I'll add really quickly just because we already have this. So as a local agency, the Hope Center covers Aspen to Glenwood, Glenwood to Parachute. So we cross 3 counties. A lot of bigger companies pay into an employee assistance program like Triad or Minds and Associates. Some of your smaller businesses or nonprofits don't have the funding to be able to hire or have on contract an EAP service for staff. We work locally with several of our nonprofits and small businesses to do an EAP program, and I'd be happy to talk to others who are interested in that. But an employee assistance program allows people to seek therapy without having to pay for it and keeping it anonymous with their employers. So the agreements that we have are just kind of small interagency agreements where an employee can come to us. They say they work for a certain business. That business has an agreement with us. And when we bill the company or the small business, we don't even attach a name to it. We just say you had 1 employee that came 4 times this month. So we are an agency that does that locally for people who might be interested and don't want or have the ability to have a big EAP. And we work with the Basalt Chamber for just that purpose.
Anyone else have anything to add to that one?
Yeah, I can add that Aspen Strong has a workplace partnership program that we do that really kind of helps with that like top-down management of we're kind of like an entryway, if you will, into mental wellness and mental health. So we can come into the organization and help you talk to your employees about what kinds of mental wellness plans that you do have for your organization, and kind of do a mental health 101 presentation and just kind of get the conversation within the organization. I think it's really important for people to feel supported by their employers.
Angelina, absolutely. I'm glad that you guys are doing that. I think I've had folks come in and they say, what's really helped is that my boss is okay with me taking time off. My boss has said she understands that mental health is a priority. So whether it is, time off or even just a private spot to do the video chat, it's even small things like that, I think, make a big difference when people feel the support. Mm-hmm.
So this has been a tough year for a lot of college students and university students. The Colorado Mountain College has multiple campuses here in our region. I wonder if there's anything specific or unique that you might suggest just for either self-care or either classmates or students or some of the folks that may be engaged at the university level.
We've had a couple of presentations with CMC across the counties. One was with a group of RAs at the residential campus, talking with them about identifying within themselves and in their peer groups signs of stress and depression and potential suicide. We've also offered a grief and emotional processing workshop to staff at CMC and across all schools in all districts in our region to help set those people up for success going into the summer. We have everyone, I think, is looking forward to a nice recovery this summer, but similar to what we talked about earlier, you can't really be receptive to that rest and rejuvenation if you haven't done the emotional processing work. So we've done a 7-part mini workshop series so that people can lead themselves through some of this. It's designed for people with really busy schedules. So the videos are 3 to 5 minute little clips, and I am happy to set that up with anyone who's interested. If you want to reach out to us, we can do it at any group level, business, any organization at all, for people to access that.
Nan, you had mentioned that all 3 of our regional counties have prioritized mental health and wellness. With so much American Recovery Plan federal stimulus dollars, it's over 25 million, I believe, coming to our region. Is there a wish list of how any of you might like to see some of that that money invested in our local communities? And I ask this specifically if there are local officials that may be tuning into this to hear from you, the direct service providers, what areas you think might be well invested with some of those funds.
Well, I'll just get started. I sat in on one of the governor's listening sessions, and a lot of people mentioned mental health support for our children in early childhood and using the funds to really build a more robust statewide set of services. We know in the rural areas that we have really good services and we need more. So looking at how we build parity in the rural areas, so we have services that are similar to what you would find in an urban area, is something that I heard.
Anyone else?
I would agree with that. And I would say again, with the kids, not just treatment as a response to someone needing therapy or in a time of crisis, but more along the lines of the prevention. If we could find a way to fund more day camps, things this summer to help keep these kids busy, you would put people to work to run them. You would give parents a break. It would allow parents to work. It would allow kids some socialization. It would allow them to get out. And I think right now, if we just kind of open the butterfly cage and let the butterflies fly, you're going to have less crisis down the road. We are preparing for a difficult fall with our kids based on what they've been through, to be able to mitigate that a little bit this summer by finding a way to get these kids out, get them socialized, get them connected, but keep them supervised, I think would be amazing. I don't even know if we could understand the magnitude of what it would do for our kids.
Well, I want to thank you all for joining today's inaugural Hearst Community Initiative Town Hall Speaker Series. This presentation was the first of 8 webinar events broadcasting every 2 weeks now through the end of July. You're invited to register for more events in this series by visiting us online at aspen2parachute.org, and that's the number 2, aspen2parachute.org/events. Our next presentation will be Tuesday, May 4th from noon to 1 p.m. Mountain Time on the topic of equity in HR. Best Practices for Small Business, featuring Brian Alvarez Terrazas, Project Manager of the Equity Action Project at Manaus, Ross Brooks, CEO of Mountain Family Health Centers, with our featured moderator, Maisha Rainia Forbes, who is Aspen Institute's own VP of People and Culture based at our headquarters in Washington, D.C. We're honored and privileged to have all of you today. For those of you who are watching, you can find more information on the Aspen Institute's initiatives to engage with communities of the Roaring Fork and Colorado River Valleys at aspen2parachute.org. I'm Evan Zislis. Thank you for joining us, and we'll see you next time.